Welcome to Community Health Heroes Show, where we spotlight local organizations that provide much needed health and wellness resources and information so that everyone in our community can strive to live healthier, happier, and longer lives. I'm Dr. Penny Walker, Senior Medical Director for United Healthcare Southeast Region. Thank you for joining us. Today on Community Health Heroes, we'll be speaking with Dr. Vijay Patel, medical oncologist, West Jeff Medical Center, about skin cancer awareness. Dr. Jerry Satanovich, Chief Medical Officer of MHM Urgent Care, will join us to talk about what ailments and what you should do to seek care for neighborhood health clinics. Michael Barnes, Program Assistant, Boys and Girls Club of Southeast Louisiana, who will stress the importance of physical fitness and sports for combating childhood obesity. And with National Walking Day being recently celebrated on April 2nd, we will share an interview with Glenn Galemi, CEO of United Healthcare Gulf States Region and Board Chair for the American Heart Association Southeast Affiliate, who will talk about our city's latest walking path in Lafayette Square and the importance of walking for good health. So don't go away, we'll be right back with more Community Health Heroes.
Sometimes life throws you something unexpected, but the Breeze Dream Foundation and United Way are giving both individuals and businesses a chance to help folks in our region. You can be the one to help those in need weather their personal storms, both large and small. You can be the one to help others rebuild their lives and get back in the game. Because when you give, amazing things happen. So step up and be the next one.
Find out how you can help at thenextonesela.org.
Now the big guy comes off the bat, hitting .342 with 92 RBIs and 36 homers. First pitch and foul between
Chill raw and prepared foods promptly. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Festival season is officially here and people are out enjoying the sun's first warm rays. But be careful when you're out playing or working in the sun, because according to skincancer.org, 1 in 5 Americans will develop skin cancer over the course of their lifetime. In recognition of May being Skin Cancer Awareness and Prevention Month, we have with us today Dr. Vijay Patel of West Jeff Medical Center to talk about the warning signs of skin cancer and what you can do to treat and prevent it. Thank you so much for joining us today, Dr. Patel. So we're going to be talking a little bit about skin cancer. Can you tell me what skin cancer is?
So skin cancer is actually, just like it sounds, it's a cancer of the skin. As we all know, the skin is the largest organ of the human body, so it has the greatest surface area, so most likely place to develop cancer. It's the most common cancer in the United States. I believe it's greater than 3.5 million people actually develop skin cancer in the United States every year.
And are there different types of skin cancer?
Yeah, there's multiple different types of skin cancer. The most common types are basal cell melanoma and squamous cell carcinoma.
Okay. And what can a person do if they want to help prevent themselves from developing skin cancer?
Yeah, it's protection against the sun, actually. So I know it's the summertime and people are going to be outdoors. If you're going to be outdoors, try to wear a hat to try to protect your face. Wear lip balms that have sunscreen on them. Try to wear clothing if you can. If you're outdoors for long periods of time, try to stay in the shade. If you have to be outdoors and you have to have your shirt off and so forth, try to protect your skin with sunscreen. Look at the bottle, make sure it's SPF of 100 or greater, make sure it's compounded so you have protection against UVA and UVB. Apply about an ounce all over your body every 2 hours. Make sure it's water resistant. I know a lot of people believe that if it's water resistant, you go in the water and you come out, then you're not going to get UV exposure, but you do, because a lot of people wipe themselves off, so you want to reapply the sunscreen. And that's the best ways to prevent it. And also avoid tanning beds. Tanning beds have UVA and UVB, and they can all lead to skin cancer.
So it's really important to reapply the sunscreen even though it says it's waterproof. And I know
Absolutely. Nothing's 100% guaranteed. And
Yes.
plus, when you sweat, you do wash some of that off.
Right.
So just like the recommendation is, do it every 2 hours.
Okay, and I think that's really valuable information. I was recently on vacation in a sunny spot, and lots of the kids were sunburnt because their moms said, "Oh, it's waterproof," and it didn't work. So I don't think they read the label.
No.
And so we talked about types of skin cancer, some prevention. Can you tell me a little bit about what causes skin cancer?
Most common reason is sun exposure. UVA and UVB does DNA damage to your skin. Eventually that leads to skin cancer.
Okay, and folks of different complexions, is it just as dangerous for folks that have olive or dark complected skin as it is for folks that are lighter complected?
Well, anyone can develop skin cancer. However, darker pigmentation, your melanin actually is a protective barrier for your skin. So although darker skin complexion people can develop skin cancer, lighter skin people, fair skin people, blonde hair, blue eyes, as they have less pigmentation, they have an increased risk of skin cancer. But anyone can develop it.
Do you recommend sunscreen though for folks with darker complexion too?
Absolutely, absolutely. Everyone that's going to be in the sun should get sunscreen and try to get an SPF of 100 or greater. Make sure it's compounded with UVA and UVB protection like we talked about. Make sure it's water resistant, but everyone should have sunscreen.
And how often should somebody have their total skin evaluated by a physician?
There's no recommendation for that. The recommendation is if you have a lesion and that area is getting worse, it's changing, it's that skin spot that's not getting better over time, you should get that evaluated. Or for melanomas or for moles, we have our secret doctor algorithm of the ABCDEs. So if you have an area, if you have a mole and you divide it in half and it's asymmetrical, meaning one area looks different than the other, that's concerning and you may want to get that checked.
Okay.
The B's borderline. If it's a round confluent area, that's less concerning. However, if there's spiculations or if there's jagged areas of the mole, that's concerning. The C is the color. Is one area darker than the other? Is there areas that are different colors in that same mole? That's concerning. The D is the diameter. If it's greater than 1/4 of an inch, it can be concerning. And 1/4 of an inch is about the size of a pencil eraser.
Okay.
Not to say that lesions smaller than that cannot be melanoma, and not to say that areas bigger than that is guaranteed a melanoma, but that is
Okay.
concerning. And E is evolution. If this mole is getting bigger, changing, if it's starting to ooze, if the color is getting worse, if it's getting a lot larger, then that's concerning. But that's those people that have these multiple changing things are the ones that should be concerning. But people that have no lesions, you don't need to get random skin checks now.
So Dr. Patel, what would you say to a young person who really wants to tan?
So anyone can develop skin cancer. You can develop at a young age, you can develop it at an older age. People that tan early do develop wrinkles and skin damage early, and that does lead to skin cancer further down the road. Whether it be in 10 years or 20 years, there is a risk of getting exposure and developing cancer down the road. So I try to say the same recommendations that I do for elderly people, sunscreen, and try to avoid UV exposures as you can. As I mentioned earlier, tanning beds can also increase your risk of developing skin cancer. Tanning beds do have both UVA and UVB. I've had patients ask me, well, if I'm only tanning once a month, am I still going to get skin cancer? Well, I tell them, well, if you smoke 1 or 2 cigarettes, yes, you can still develop lung cancer. So tanning beds do increase your risk of skin cancer. There was actually a study presented last year in a major journal that showed that increased exposure to tanning beds at a younger age does increase your risk of melanoma down the road.
And so you've provided an awful lot of information, but if our viewing audience wanted to know about skin cancer prevention or screening, where could they go to get that information?
They can check the CDC website or at the institution I work at, wjmc.org, and look at the information on the websites. Also, we do have a free skin cancer screening on May 15th offered through WJMC, and all that information is on the website.
Dr. Patel, thank you for providing this vital information for our viewing audience today.
My pleasure. Thank you for having me.
All right. And we'll be right back with more Community Health Heroes.
Each year, loving parents and caregivers cause serious injury and even death to infants by allowing unsafe sleeping conditions. Never sleep with your baby on a sofa, in a chair, or in an adult bed. Don't allow the baby you love to be the next tragic statistic. The only safe place for your baby to sleep is on its back in a crib. For more information, visit cribsforkids.org.
Packers, Vikings,
Red State, Blue State.
We come from different places.
Uptown.
But when we live united, we create real lasting change in the education, income, and health of our country.
United.
Real change won't happen without you. So give, advocate, volunteer, Live United. Sign up at liveunited.org.
Clean kitchen surfaces, utensils, and hands with soapy water. 1 in 6 Americans will get sick from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Did you know that 50% of conditions treated at an emergency room could have been treated at an urgent care center? With school soon ending and kids getting even more bumps, falls, and bruises at home or at summer camp, we'd like to share some important information with you for when it's right to go to an urgent care center or an emergency room. Here to tell us more is Dr. Jerry Satanovich, Chief Medical Director for MHM Urgent Care. Welcome to the show, Dr. Satanovich. Can you tell me a little bit about when somebody should go to an urgent care versus an emergency department?
Well, it's actually a case-by-case situation, but to give you an idea, the things that we see in an urgent care center that a lot of people go to the emergency room for are upper respiratory infections, coughs, colds, flus, lacerations, people cut themselves, sprains and minor fractures. People think they might have broken their wrist or broken their ankle. We can handle that. Those are some of your good examples of what we could see at an urgent care center.
Can you tell me some other advantages of going to an urgent care versus an emergency department?
Well, a big one, time and convenience. Everybody's time is valuable. And in our urgent care centers, we typically have a door-to-door time, depending on the time of year, anywhere from 35 to about 55 minutes door to door, which means, which compared to the emergency room where your length of stays can be measured in days, not minutes.
Right.
So we are able to get people in and out quickly and respect their time. Additionally, we're located in very convenient locations, and we're open, extended hours. Our centers are all open till either 8 or 9 at night, all open 7 days a week.
Okay. And what kind of services do you actually provide at your urgent care centers?
Our urgent care centers at MHM, we have in-house lab, so we can do our labs right there on the spot. There are some that we may have to send out. We also have in-house X-ray, which is digital X-ray. Additionally, we can sew up lacerations, and we can lance abscesses, take care of things like that.
Sometimes our audience will ask, they'll ask, will they see a real doctor at an urgent care center?
Well, at our centers, we're always staffed with a physician. In some centers that get very busy, we'll have a physician's assistant to help them. But people should expect to see a physician.
Okay, so they'll see a real doctor.
A real doctor, yes. Most of our doctors are, like myself, either emergency room physicians who have done ER medicine for a long time and decide they want to slow down their pace a little bit. Some of our physicians are, primary care doctors who wanted to get out, and we have some that are young physicians who finished in family practice who are uniquely qualified to do urgent care, who come work for us straight out of residency.
That's very good information. And then do you take insurances?
Yes, we do. We at MHM are on almost every major insurance plan.
Okay.
And so when people come to see us, they are subject to the same co-pays and deductibles that they would be otherwise due to pay.
According to whatever their insurance policy covers.
That is correct.
All right. And I heard,
I'm sorry for interrupting you, but most of the insurance companies would much rather have their patients come to an urgent care center when the urgent care center is appropriate, because it's actually, quite honestly, it's cheaper for the patient, and it's less expensive for the insurance company as well.
Absolutely.
So it's a win for everybody.
Awesome. And I heard you opened a couple new centers recently.
Yes, at MHM, in the last few months, we opened up in River Ridge, we opened up in Mandeville, in Slidell, we opened up on the West Bank, and also in Houma. We are soon to open in Mid-City and in Covington and in Hammond.
Oh my goodness. How many total centers do you have now?
At this point, 12, soon to be 15.
That's great. So you're pretty much covering the whole entire area.
Yes, we are. We're trying to get a nice geographic footprint here in the metro New Orleans area.
Great. And if our viewing audience wanted to find out more information, how would they find out more information about your centers?
Well, the easiest is our website, which is myhealthcarematters.com.
My Healthcare Matters, okay.
.com or mhmurgentcare.com, same website.
MHM Urgent Care, okay. This is just a very, very valuable information to our audience. Is there anything else you'd like to share with us?
Well, one thing we're specifically proud of at MHM is that we were the first urgent care company not affiliated with a hospital to become Joint Commission accredited. As you know, but I'll explain to the audience that the Joint Commission is the gold seal of approval, so to speak, for hospitals and healthcare organizations, and it is very difficult to both get that accreditation and to maintain that accreditation. But certainly when people walk in and see that gold seal, even though they may not know what it is, if you investigate it, it tells you you're at a quality organization that follows all the standards
Absolutely.
that are needed to ensure their safety.
Absolutely. So it's a seal of approval setting standards for urgent cares.
Absolutely. Well, for all healthcare organizations, but urgent cares in specific. And as I said, we were the first non-hospital owned urgent care centers to get that designation. Very proud of that.
So when somebody goes to MHM, you know you're getting quality care.
Absolutely.
Well, thank you so much for joining us on the show, Dr. Cvitanovich. I really appreciate this.
Thank you for having me.
And we'll be right back with more Community Health Heroes.
Quiet, please. Wait a sec. I'll take one. Oh, yeah. All right. All good. Take care. Way to go. Nice. Bring it on. Gotcha. I'm here for you. Oh, no. Please, please, please. I'm waiting. Interesting. Not buying it. Not fair. That's it. This conversation is over. Oh, brother.
Body language can tell you all sorts of things.
I'm having a stroke. I'm having a stroke.
Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty.
Here we go. We're gonna make some juice.
It's gonna be good.
She's excited. A little bit of kale.
Please don't put this online. I'm putting it all over the line.
It's wet. It needs something. No, it'll go.
Don't break my juicer. Looks good.
You ready to try it?
Come on, baby.
Challenge your kids to be active and eat healthy.
It's okay.
Okay, all right.
They might surprise you.
She took another sip. You saw it?
Search We Can for more ideas on how you and your kids can get healthy together.
So this is my computer.
This is your computer. Let's go on the internet.
Let's go. Click it.
Yes.
Okay.
I cursor in between the R and the E. Pressing dot, I want you to just push the period.
She's gonna love me all over again now.
That's it. Jamaica, here you come.
Here we go.
Good job.
Thank you. Thank you. And I did it by myself. Feel smarter.
The U.S. Department of Health and Human Services recommends that young people aged 6 to 17 years participate in at least 60 minutes of physical activity daily. One organization that is helping our kids fight childhood obesity while preparing them for a bright future is the Boys and Girls Club of Southeast Louisiana. Joining us today is the program assistant of the New Orleans Area Boys and Girls Club, Mr. Mike Barnes. Thank you for joining us today, Mr. Barnes.
Thank you. Nice to be here.
Can you tell me a little bit about the services that Boys and Girls Clubs provide?
Well, Boys and Girls Club, we provide opportunities. We provide education, fitness, whether you wouldn't probably get in most schools or you probably wouldn't get at home.
Okay. Can you elaborate on that? Like, is there basketball or volleyball, running tracks?
Well, actually everything, basketball, football, soccer, baseball, everything really. Just something small as just jumping rope. You know, we have a jump rope contest. And then we'll see who can last the longest. And that just give kids fitness.
Absolutely. With 1 in 3 kids in America being obese right now, how important is sports and activities such as jump roping and basketball?
It's very important because it keeps you healthy, keep your energy skyrocketed where you can actually perform well in class. You
And do you have like teams? Like, do you have like basketball teams or volleyball teams?
Well, we have flag football.
Flag
and,
football?
Yeah, flag football was last year, and we had 11 teams. 11 teams.
Nice. So how many kids participate at your programs?
90%.
90%.
90%. Not just in football. They participate in all the sports.
Mm-hmm.
I mean, you have girls come out there to play football with the boys, or
that's nice.
They play basketball with the boys, or baseball. I mean, all the sports. We don't just cut it off at boys play this and girls go and jump rope. We have girls and boys play together.
That's great, great. So you had a recent event called Ironman. Can you tell me a little bit more about that?
That actually was an amazing event.
Okay.
I mean, we actually had the kids were psyched about it, and once the kids came out, and we also had parents to be involved in the race with the kids.
So was it a running activity or was it multiple sports? What was
it was just a running activity. They ran, I believe it was half a mile, and it was just around, and then they came back, and then we cheered on, and then the Iron Kids, they gave us $3,000 for that particular event.
Great. So you raised $3,000?
Mm-hmm.
That's incredible. And what will they be using the money for?
Just for all type of stuff, programming, equipment, books, stuff like that for the kids. We even trips.
Well, that's really interesting. So United Healthcare donated $3,000 for the Iron Kids event. That's absolutely wonderful. If somebody wanted to know a little bit more about your programs, how could they find out more information?
Just contact the Boys and Girls Club.
Awesome. On the website?
Yes.
Well, great. You provided really valuable information to our viewers today, and I really appreciate you being here today.
Thank you. Anytime.
And we'll be right back with more Community Health Heroes.
NFC, AFC, offensive linemen, defensive tackles, quarterbacks, and cornerbacks are all working with United Way for a million little reasons. The kids of our communities, to ensure their academic success all the way to graduation day. You see, it takes about 12 years to create a graduate, but it takes the same time to create a dropout. And the difference between a kid becoming one or the other could be a professional athlete, or it could be you. Studies showed the earlier we get to kids, the better their chances. So become a United Way volunteer reader, tutor, or mentor, and make a difference in the life of a child, for the life of that child. Give.
Advocate.
Volunteer. Live United. Join your favorite NFL players. Take the pledge. Go to unitedway.org.
Are you getting this, honey?
Oh, prime time. We are rolling.
All right, Mama's gonna bring it home. Mama's gonna bring it home. Okay.
Come on, watch this guy.
Oh, backwards.
Oh, don't. Oh.
It went into Bob and Carol's yard. Oh, no? Okay, here it goes.
Oh, no!
Challenge your kids to be active and eat healthy.
All right, let's see what you can do. Let's go.
They might surprise you. Search We Can for more ideas on how you and your kids can get healthy together.
The American Heart Association's National Walking Day recently took place in New Orleans on Wednesday, April 2nd. To celebrate the day, the American Heart Association invited local CEOs, civic and political leaders, celebrities, and survivors to walk 30 minutes on a treadmill to showcase the importance of walking to living a healthy life. They also used the opportunity to announce the third United Healthcare American Heart Association designated walking path located in Lafayette Square in downtown New Orleans. The following is an interview we taped on National Walking Day with United Healthcare's Gulf State CEO, Glenn Galemi, sharing his thoughts about the newest American Heart Association designated walking path and the overall importance of walking to good heart health.
We are at Whole Foods in New Orleans, Louisiana on beautiful Magazine Street in Uptown. We are celebrating National Walking Day for the American Heart Association. It's a special day because it gets folks active. And when we talk about walking, it's the lowest barrier to entrance into some physical activity. So we talk about that each individual should look at about 30 minutes a day of physical activity. And so if you're walking, how much easier can it get than that? You can do it anywhere. You can do it in your office. You can do it around your house. You can go do it down through your neighborhood. So walking is a great way to get started. Doesn't require any equipment to get started. So that's why it's something that we really try to encourage with the American Heart Association and with United Healthcare as well. We have National Walking at Work Day, Okay, so what we'll do is at least annually, but sometimes more, is we'll have walking at work events. We'll invite other companies to join us and have challenges as a result of that. And we'll have folks, I'll even come out, to go out for a meeting or go to lunch, and I'll see people walking up and down the halls of our office, getting in their 30 minutes each day. So those are some of the things that we try to promote. Today, it's actually our third walking path that United Healthcare, collaborating and in connection with the American Heart Association, is putting its third walking path here in New Orleans, and it's at Lafayette Square. And we're so excited about it. It's obviously a very popular square because there's concerts and so forth that happen there on a weekly basis. And so now there'll be signage for individuals who want to walk there that says exactly how far they need to walk, how long a mile is, or how many times they need to go around, so that they can track how much activity that they're having for that day, not only from a time standpoint, but from a distance standpoint as well. So we're real excited about that, and it's in conjunction with the concert that's happening tonight. We're having the grand opening for it.
Getting closer to nature can get you closer to your family. Go to discovertheforest.org.
For those dealing with the daily struggles of caring for a loved one, we hear you. That's why AARP created a community with experts and other caregivers to help us better care for ourselves and the ones we love.
When you have a hole in your neck, don't face the shower head.
Suction out your toe before you eat. Crouch. Don't bend over. You don't want to lose the food in your stomach. Don't use spray paint.
Be very careful shaving.
Thank you so much for joining us. If you would like to suggest a health topic or send us information on your health organization's events, please visit our Facebook page or email us at communityhealthheroes@gmail.com. We hope that the information we provide today will help you and your family live healthier and happier lives. I'm Dr. Penny Walker, and I'll see you next time on Community Health Heroes.